Hello friends, this is the MCQ on hematology. Let's figure it out. Hyperchromic anemia is seen in which of the following? Most likely to be seen in which of the following? Hereditary spherocytosis, or is it thalassemia, or sickle cell anemia, or none of the above, because anemia can't be hyperchromic. That's the MCQ. So what's your take on this? Let's see. Well, the answer is hereditary spherocytosis. So let's understand the basics first. The anemia can be either hypochromic or normochromic or hyperchromic. And it's based on what? Look, chromic means color. So you need to understand this blood index called color index. It's related to the color of the RBCs. You know, the RBC color is because of the hemoglobin present inside the RBC. And the color index is calculated like this. It is hemoglobin percent upon RBC percent. Please understand, it's not the absolute values of hemoglobin and RBCs. It's the percent of hemoglobin upon percent of RBCs. Means 15 grams of hemoglobin is taken as 100%. So if the patient's hemoglobin is 12 grams, then how much it is in percentage terms? Similarly, RBC percent, 5 million RBCs is taken, it is taken as 100% RBC count. So if somebody has got 4 million RBCs, then it is 80% RBC count. So it's about the percent upon percent. Now, the normal value is 0.8 to 1. Of course, no units because it's percent upon percent. Normal value, the normal range is 0.8 to 1. And therefore, if it is less than 0.8, it will mean what? Hemoglobin is less. Numerator, hemoglobin is less. And therefore, the value less than 0.8, this will be hypochromic anemia. Then, if the value is between 0.8 and 1, then it will be normochromic anemia. Normal color of the RBC. Reduced color, hypochromic, and obviously it is because of the less hemoglobin which is on the numerator. And now the interesting part, if the value is more than 1, then it is hyperchromic anemia. And the question that is most commonly asked is whether hyperchromic anemia is even possible, practically possible. Well, yes, it is possible. See, if the value is more than 1, that means numerator is more and the denominator is relatively less. Okay, so in a patient, hemoglobin is more and in relative terms, the RBC count is less. So if the hemoglobin is more or hemoglobin is normal and RBC count is less, will you like to call it anemia? That's the question. Yes, it is still the anemia. And what type of, or what is the example? The example would be hereditary spherocytosis. So with this background, now let's understand something about the hereditary spherocytosis. Now, first of all, RBC, normally it is biconcave shaped, and due to mutation of some protein in the RBC membrane, if it becomes sphere shaped, then this condition exists, that is called as spherocytosis, sphere shaped RBC. Note two things here. One, the RBC shape has changed, and second, RBC volume decreases. That's a very important point to understand this MCQ. Volume of the RBC also becomes less in this particular condition. Right. So just a quick theory part. Well, this is the RBC membrane. and you have to know certain proteins in the RBC membrane. This is the band 3 protein, which is associated with band 4.2 protein, and then ankyrin, and there are two subunits of spectrin, alpha and beta spectrin, and it's also associated with the actin, which is a part of cytoskeleton. So these are the 4 proteins which are very important so far as the RBC membrane and its flexibility, biconcave shape is concerned. What are those 4 proteins in the RBC membrane? Spectrin, ankyrin, band 3 and band 4.2. Mutation of any of these will result in spherocytosis. The commonest being ankyrin. Please remember, ankyrin mutation is the commonest form of spherocytosis. But nevertheless, you may remember these 4 names: spectrin, ankyrin, band 3 and band 4.2, the proteins in the RBC membrane. Now, we are saying that there are hyperchromic red cells, which means what? We already discussed about the color index. It is HB percent upon RBC percent, and if it is more than 1, that means relatively RBC count is less, but hemoglobin level is normal. So relatively the color index becomes more than 1. See, what happens here is RBC volume is reduced, which is what I mentioned just now. RBC volume is reduced, but there is normal amount of hemoglobin formation. Hemoglobin in the body is normally formed, normally synthesized, but the RBC count is less because RBCs are getting destroyed faster. Their membrane has become rigid. Sphere shaped RBC, rigid membrane, RBC breakdown faster. So RBC count is less, and therefore denominator is less and relatively numerator is more. So color index becomes more than 1 and we call it hyperchromic anemia. All right. And the other index that you should know is MCHC is increased. Mean corpuscular hemoglobin concentration increases. It becomes more than normal. Now, let me just quickly explain this. In a single RBC, how much volume of the a single RBC is occupied or saturated by hemoglobin? The normal value is 32 to 38%. That is called as MCHC, mean corpuscular hemoglobin concentration. Somewhere between 32 to 38% volume of a single RBC is occupied or saturated with hemoglobin. Now consider this. RBC count is less. Single RBC volume also is less than normal, but hemoglobin level is normal. So smaller RBCs, and since the hemoglobin is normal, hemoglobin is occupying more than 50%, 60% volume of the RBC. So in a normal RBC, hemoglobin occupies some 38% of the cell volume with a central pallor. Central area is pale. That central pallor disappears and most part of the RBC is filled with hemoglobin, because MCHC, mean corpuscular hemoglobin concentration, will now increase. Smaller RBC and it is completely filled with hemoglobin, no central pallor, and of course therefore hyperchromic anemia, increased MCHC. That's the morphology which is seen in hereditary spherocytosis.